I'm gonna be doing Foley care. I'm gonna take and check the orders, check the patient's name, make sure it's the right patient, check their medical record, check their birthday, and just confirm. I'm gonna explain what I'm doing. I'm gonna be inserting a Foley catheter. I'm gonna be checking my packaging, making sure there's no holes or anything's been tampered with. Check my expiration date, and then I'm going to open my kit. I'm going to pull out my kit. I'm going to use this as trash. Be sure to use this as trash. Okay, I'm going to drop this in the trash. Then I'm going to use a 1 inch. Make sure not to contaminate. Use my 1 inch. Alright. Then I'm going to my gloves. 1 inch. With my sterile gloves. Use my hand hygiene also before I start this process. Use my sterile gloves, making sure not to contaminate anything. Open this up with the 1 inch water. Open my gloves up with the 1 inch water. I'm gonna take the gloves out, making sure not to contaminate anything. These little tiny gloves. A scoop not to contaminate. I'll touch the sterile parts and drop and put in the trash. Then I'm going to use my drape with the patient, with the shiny side down. I'm going to put this under the patient. And I'm going to use a drape if needed over top of the patient. Okay, still using the sterile, everything's still sterile. Going to set my sterile field. I'm going to prepare all of my solutions. I'm going to open this. Still sterile. I'm going to check my balloon. Make sure nothing's wrong with my balloon. And once that's connected, I'll stick that up there. That's good. I'm going to open my gel and squirt that in, and then stick my lumen inside the gel. Then I'm going to contaminate my hand and open. I'm going to take my swab and swab the right side of the labia. I'm going to drop it in the contaminated side. I'm going to take another swab and do the left side of the labia, and then I am going to take the third and go down the middle, cleaning of it. Then I'm going to take which I have to keep it open. I'm going to take my lumen and inject it, making sure not to touch anything. And when I see urine, I'm going to continue to advance it. Alright, so now that that's in, I am going to hold that in place and insert my saline inside, making sure that the balloon is okay and that the Foley stays in. I'll give it a little pull just to make sure that it's secure. And then after, I'm going to discard and throw away everything.